Howdy folks. I've done a few different videos now on all the cool gadgets, from comms to flashlights to knives. Well, I figured I'd do one on my EDC bag. The bag that I carry with me with all my crap in it. Why do I have such a big bag? Well, this is the Moab 10 from 511. And really, if I didn't give a crap about anybody else, I would have a smaller bag. But basically, a lot of this bag is medical and trauma. Everything I would need for myself or for others. That's why it's bigger, because I have a family. I might run into your family, and when something's going down, you want to be able to help people. So, I like a bag that can all be compact and what you need. I have the Moab 10, so on the side I have my multi-tool, the Leatherman that you have seen. My Cold Steel SRK C for compact, you've seen. My flashlight, also that you have seen. On the other side, I have my trauma kit, my Baofeng ham radio, which I carry two, because usually I'm with my family, so I can hand one off to Val in case of emergency. If we get split up, we can stay in communication. And, of course, it's a sling pack, so I just have to throw that over one shoulder, and away you go. Top pouch basically has my wallet, ID, anything I need really in it. Front pouch, medical, face shield for CPR. I got some allergy medicine, some painkillers. This side here, these two compartments right here are made for AR-15 mags, but use them for whatever you want. I have this one filled with rubber gloves in case you need to do first aid. I have I keep wet wipes, emergency blanket, keep people from going in shock. At the bottom I have my fire kit. These it just kind of fits perfectly in there and you forget about it. I got some Visine, just normal stuff. Some EMT shears, normal stuff. And back here in the zipper compartment I have face masks. Not just because people keep talking about corona and stuff, but if you're working on somebody and there's arterial spray, you don't want it in your mouth. You don't want any of their body fluids in your mouth. Just saying. Inside, okay, they can spread the compression straps out. I have my little EDC pouch, so if I need to change into shorts, if I'm going swimming or whatever, I put all my knives, different things in that pouch. Now, I have medication, blood pressure cuff, that way I can take people's vitals. Bigger first aid kit. Basically, it's a boo-boo kit, has everything you can imagine from gauze to band-aids to good stuff. Roll of toilet paper. Self-explanatory. Shit happens. I have a cold pack, just because. Now, I also keep my stethoscope. That way I can make sure people's blood pressure aren't skyrocketing, or I can Well, it just gives you more data when you know people's vitals. The rest of the stuff keeps changing out. I have everything from triangle bandages to chargers to whatnot. But let's take a look at that trauma kit. Now, let's take a look at this trauma kit. See, there's one thing to have first aid, which is good. Everybody should have first aid kit. But if you're in an area where people can really get hurt, whether it's everything from a mass casualty like a train wreck, car accident, active shooter, I don't know where you're from, but you want to be prepared to be able to sustain people until real help arrives. So I always try to keep some kind of a trauma kit. This is a makeshift one that I kind of put together fast. It's MOLLE compatible, so it's kind of just on the side of my bag. So it's designed with the 2 zippers that you can just grab it, pull, and it opens. We'll start at the bottom of the bag. I keep gauze, because you never know when you need to pack a wound. I have Quick Clot. It's a hemostatic agent, granules, 15 grams. You can pour that right into the laceration or the cut, and that'll stop the bleeding pretty fast. And a small rat's tourniquet, because you never know when you need to stop a lot of bleeding. And I coined a phrase. Well, I didn't coin the phrase. I took a phrase that Skinny Medic on YouTube. You should check him out. He's pretty good, but he has this phrase that tells you when to put on a tourniquet. If the first thing that pops into your head is, "Oh my God, that's a lot of blood," you need a tourniquet. If that's not the first thing that comes to mind, you could probably get away with something a little less drastic. So what I always keep is good old Israeli bandage. Do some Googling. You can. There's lots of videos on how to use these. I think everybody should have one, or many of them. Put them in your bags. It shows you exactly how to use it on the back, so if you need to hand this to somebody, either they're helping you or you're the one with the injury and you just can't, do this because you don't have arms or because they're hurt or you only have one. This right here will get them some instructions in case you pass out. And of course, I keep a bunch of just gauze, triangle bandage, some extra gloves, and that's pretty much it that I keep in that. I can't stress enough. Little items like this, it's small. Keep this in your bag, in your car. You never know when you might need to stop bleeding. Very important to keep that red stuff inside you. Anyway, you guys have a wonderful day, and goodbye for now.